Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Mujahid Buneri. Welcome to the channel Dr. Mujahid Buneri. I hope you are doing well. Today, my topic of discussion is encephalitis. Before starting discussion about encephalitis, I would like to tell you the learning objectives of today's lecture. It includes number 1. What is encephalitis? Number 2. What are the etiologies of encephalitis? Number 3. What are the clinical features of encephalitis? Number 4. What specific investigations will you advise to diagnose encephalitis? Number 5. How will you treat encephalitis? At the end of the lecture, I will ask 3 questions regarding encephalitis. Search the answers and give your answers in the comment section. Okay, let's begin. What is encephalitis? It is the inflammation of brain parenchyma. You must differentiate it from meningitis. Meningitis is the inflammation of the covering meninges of brain. Encephalitis can affect anyone irrespective of age, sex, and ethnicity. It is believed that within each and every minute of the day, one person gets the disease. So it is a common disease. Now, coming to the etiologies, it is most commonly caused by viruses. Although bacteria, protozoa, and rickettsia may cause encephalitis. Amongst the viruses, most common virus responsible for encephalitis is herpes simplex virus type 1. It commonly involves temporal lobes. Multiple choice question for examination. Cytomegalovirus may cause encephalitis. It usually involves areas around ventricles. Point to be noted. Other viruses which can cause encephalitis include varicella zoster virus, adenoviruses, and enteroviruses. Okay. What are the clinical features of encephalitis? It includes number 1. Most commonly, the patients present with acute onset headache, fever, and altered sensorium, such as lethargy, drowsiness, confusion, stupor, and even coma. Patient may present with neurological deficits like aphasia, hemiplegia, etc. There may occur seizures. Some patients may present with signs of meningeal irritation like neck stiffness and positive Kernick sign, but this is mild to moderate in severity. Okay. How will you investigate the patient? Number 1. CT scan brain is the best initial investigation because of the presence of altered sensorium. Number 2. Lumbar puncture and cerebrospinal fluid routine examination. It is normal in 10% of cases. Another multiple choice question. In 90% of cases, protein is elevated but less than 100 milligram per dl. Glucose is normal. Cells will be predominantly lymphocytes. If red blood cell is present in cerebrospinal fluid without history of trauma, then your diagnosis will be herpes simplex virus encephalitis. Point to be noted. Polymerase chain reaction of CSF is the most accurate test for diagnosis of viral encephalitis. Its sensitivity is 98% and specificity is more than 95%. Another multiple choice question for examination. Moreover, other tests which can be advised include MRI brain and electroencephalogram. Okay. What is the treatment for encephalitis? It includes number 1, intravenous acyclovir for herpes simplex virus and varicella zoster virus encephalitis. Number 2, Gynaecology with or without postcarnet for cytomegalovirus encephalitis. Number 3, give steroids like dexamethasone 8 mg 12 hourly for raised intracranial pressure. Number 4, give anticonvulsant therapy for seizures. Number 5, support your treatment such as antipyretics for fever and analgesics for headache, etc. Coming to the last section of today's lecture, it includes questions. Number 1, a woman is having, sorry, a woman is using acyclovir for 5 days in hospital for herpes simplex virus encephalitis. You advise serum creatinine. It is raised. What will be your next step of management? Number 2, what is post-encephalitic syndrome? And the last question is there any vaccine available for encephalitis? This was all about today's lecture. Thanks for watching.